One of the things I'd like to bring to Akasha Health is preventative care to try to help our patients optimize their health in a way that they're happy and living a better life with their current situation. We want to make sure that they get their testing done. They want to make sure they're happy, they're healthy, and check their bodies from the inside out. With primary care, we're focusing on treating patients and helping them to become best health that they can. And with osteopathic medicine, we're going to be using evaluation of the whole body, trying to make sure that they are free of pain, free of tension, free of stress, to help bring their health to an optimal level. We try to treat the whole person, not just the injury itself. One of the most common things that we see in my practice is chronic neck and back pain. And we will often see people that may have an injury but also have recurring pain to the areas of the spine. And when we evaluate them, we want to take in a good history and physical and an examination to make sure that they are in alignment, in correct posture, in doing the things that will help them to become more aligned and try to free them of their pain by using a manipulative therapy and also postural techniques. But we always start off with a history on the patient. Where is the pain coming from? When did it start? Where it's located? And then we will also go into a physical exam to try to evaluate what parts of the body may be involved in causing this pain. I see often in my practice a condition called tennis elbow or lateral epicondylitis. So it's a very common condition. We see it in roughly 7 out of every 1,000 clinic visits in our practice. And it can be a very nagging, very painful condition, causing people to be very debilitated. I developed a brace which allows people to have relief from it by using a brace that is very unique in supinating the elbow, which is a different technique than anyone else has ever had. And we've had very good results in treating patients with tennis elbow. I'm an osteopathic physician. Osteopaths are fully licensed physicians. We're capable of practicing medicine and surgery. But in addition, we also learn osteopathic manipulative therapy, which is a philosophy of treating the whole body, but also a form of therapy which we are able to treat many different musculoskeletal and other types of conditions using our manual therapy techniques. Many times when someone comes to see the physician, they often have some sort of stress going on in their lives that can come out as a physical pain. So as an osteopath, we try to evaluate the whole person and try to make sure we understand that the pain may be there from possibly some stress going on in their lives. So we want to make sure we touch on both the physical but also the emotional, psychological aspect of this person. So I'm one of the physicians with the World Surf League, which is the governing body of professional surfing. So I've been working with surfing athletes for the last 25 years. We often will work at a lot of the surfing events all over the world. I've been able to cover different events in Hawaii, in California, in Europe, Australia, and this is one of the things that we've gained tremendous knowledge in working with these elite athletes over the years. So we've evaluated a number of surfers over the years, but also many other athletes with different conditions related to their sport. So for surfing, a lot of people will come in for an evaluation with neck and back pain. And we will try to get to the cause of why this person will have it. If they had an injury or if it's something from overuse, we will try to evaluate them and give them a good treatment plan. Our main goal in sports medicine is to try to keep the patient, keep the athlete going with their sport. We want to try to get them evaluated, get them some manipulation if they need, get them therapy, and try to get them back in the water as soon as they can. In my practice, we do the osteopathic manipulation is one way that has been able to treat and reduce healing time, improve their conditions, reduce pain by doing the manipulation that we feel has been effective for many patients over the years. Osteopathic manipulation has a number of different types of manual treatments that we we have. Say for someone with low back pain, we would first do a evaluation on them, check and see what is dysfunction in their spine, in their back, in their musculoskeletal system. And then we'll put together a regimen. I use a lot of soft tissue techniques. I do a lot of high velocity techniques if the patient wishes. I do a lot of muscle energy techniques. I do a lot of postural education as well. In our evaluation, we may find there's a lesion or abnormality in their lumbar spinal musculature. First thing I usually do is do some soft tissue treatments. This will help to promote circulation into the muscle, try to alleviate any tightness or swelling in the area. Once we get that going, we'll move on to a different technique. We may do a high velocity treatment if they want. These are typically spinal manipulations, which a lot of people will get great relief from. In addition, once they have become a little bit more loose, flexible, and limber, we may move on to a muscle energy technique to try to increase their strength in their spine. With a combination of that, we usually get the patients going much faster than they would without. We had a middle-aged gentleman come into my office recently with fairly severe low back pain from doing some heavy lifting, and then he had a fall. So we were able to get him in the office, evaluate him, do osteopathic manipulation, and get him back to working much faster than he normally would have. With me joining the integrative healthcare program here at Acacia, we're going to have a number of different modalities that will also be able to help our patients get better faster, heal faster. We have the PRP techniques, we have ultrasound technologies, we have other physical therapy, we have acupuncture, which may all lead to a comprehensive program that will help to get our patients back on the road faster. So one of the things that I preach quite a bit is exercise. I think exercise is probably the best medicine of any kind. I try to get my patients to exercise a minimum of 3 times a week, if not 7 days a week, because I think that will keep them the healthiest from my perspective of healthcare.